And do the roll call vote, please. Or
Yeah.
roll call attendance. I'm not caught
Same
up on
thing.
sleep.
I know what you mean. Juliet Ballard.
Juliet, yes. Dexter, Michigan.
Great, thank you. Marta Larson
Present, participating from Northfield Township, Michigan.
and Marie Gress.
Present, calling from Milan.
Margie Reynolds.
Present, calling in from Pittsfield Township.
And Elizabeth Thompson is excused. Jennifer Green.
Present, participating from the city of Ypsilanti.
Great. Phyllis Herzeg.
Present, calling in from Ann Arbor.
Okay. Bruce Astreen.
Calling from Ann Arbor.
Great. Brenda McKinney.
Present, Superior Township.
Great. Allison Foreman.
Present, calling in from Ypsilanti Township.
Great. Madden Litton.
Present from Ypsilanti Township.
Great. And Annie will be late. So you have a quorum.
Wonderful. Thank you. All right, up next is public participation. If any members of the public would like to raise their hand, we can unmute you and you can speak to the commission. I see Justine. All right, Justine.
Yes, thank you. I appreciate the opportunity. As you know, perhaps you remember, I came to you before to talk to you about assisted living. And I have been talking to Phyllis about a concern that I have that's related to that, but is an example, I think, of what happens when you offer information to people that the information isn't always meaningful. I wrote to Marie to point out this, to make this point. And the example that I'm going to give you is from assisted living residences when you seek that, because that's what I know the best. And it certainly can apply to other areas. But when older adults and their family members search for assisted living residences from organizations or social service agencies, they typically don't receive meaningful information for their education or problem solving. The search process can be complex and emotional for many reasons. When someone begins a search, it's an opportunity to educate them beyond the general information and define some of the important regulations and give them some instructions in terms of how to use the resources on the Department of Licensing and Regulatory Affairs website. So what I did was that I asked for information from the Alzheimer's Association, their 100 number, their 24/7 number. I looked on Catholic Social Services website. I went to Ageways and I got information in the Housing Bureau for Seniors, and all of them had some basic information and some helpful tips. But really, you could just do as well going on an internet search. You really weren't getting anything that provided guidance or the information kind of left you in a vacuum. So I'm thinking that we really need to provide people meaningful information. And with this example, I would say that, you're just getting typically names, addresses, telephone numbers, and websites if you go to any of these sources. Now, you can get a little more if you push, if you know the right questions to ask. And Marie said to me, well, what are the gaps? Well, the gaps is that, first of all, the care seeker doesn't get a framework for doing a search. And they need more information from realizing that assisted living and memory care have no regulatory meaning in Michigan. So that's, first of all, really important to realize when you're doing a search. They need to know what the Department of Licensing and Regulatory Affairs can offer them. And but those searches in terms of getting information about the renewal licensing reports and the violations, It's not intuitive. You really have to have some guidance on that. They need some basic information on key regulations. Also, they need to realize that each place, if you're searching for memory care, can be very different in terms of pricing structure, philosophy, mission, so that they know when they're looking at their options, how to weigh those options. So what I'd like to offer, I've been putting together a guide, and I've been working with others, and the guide has some basic information. It's called Choosing Residential Assisted Living Care in Michigan, a guide to understanding some basic state regulations, recommendations to increase safety, and action steps for care seekers. And this is something that any social service agency can use. They can give out their lists. You know, the demands of time are very limited in every social service agency. But with this, they could have a link, and it could send somebody to this resource. And not only would there be information, but there would be a workbook format so that the care seeker can go through the categories that are going to be meaningful to them and get the information that they need. So this is a work in progress. I'd like to test it with people. I like to share it with the agencies to see how it could be helpful to them. But this is something that could be used statewide and offer people something that would really help them understand the system that they're going to be engaging with. So just to get your feedback on that.
Thank you. So the commission will respond once public participation is complete. So if anyone has a response for you, Justine, we'll do it at that time. Up next, we have Katie from Ageways. There you go, Katie.
Quickly introduce myself. My name is Katie Scharf, and I onboarded with Ageways about a month ago. I am only able to join in participant view right now, so you can't see me. But I work with Stephanie. I am the new planning and grant specialist with Ageways, so I'll be more involved with your group moving forward. And I have over a decade of experience in senior housing, affordable housing, independent living, enhanced independent living, and memory care. And I also have worked in HUD regulatory compliance, and I am a master social worker. So I just wanted to say hello, and I look forward to working with you all in the future.
Thank you. Anyone else for public comment? Going once, twice. I saw a hand go up and then back down, so I'm gonna just wait another 5 seconds. Okay. Closing public participation. Any commissioners want to respond to public comment? I see Marta.
I appreciate Justine's comments about the kinds of resources she's trying to put together. And I think once the county gets a director of the Office of Aging Services on board, I would encourage Justine, you to talk to that person and try to work up a collaboration so that your resources can be used.
Bruce?
I think it's a wonderful idea to put that information together, and I applaud you for doing it. And I think it could be an incredibly helpful tool for a lot of people. The one thing I would add to your various criteria are, and I don't know how easy it would be to do this, but the whole question of who owns these facilities.
Yes, that would be on there. Ownership would be a part of it. That's right.
Yeah, and I think attached to that is kind of their reputation in terms of how they treat staff, they treat they treat residents and everything else, because so many private equity are taking over these places and are just making them worse. And I don't think a lot of people realize it's important. It's like selecting a hospital today.
Mhm.
You need to be careful about which hospitals you even go to, because
Mhm.
if it's private equity, they have a whole different agenda.
Yeah.
So anyways, I hope you can find some way to incorporate some of that information.
Yeah, I agree. Ownership information is very helpful. It can be difficult to find on Laura's website. It's possible, but finding out about their performance is a whole nother issue.
Right.
And you know, we could perhaps find a way of including that. But your points are well taken.
Alice?
Thanks, Justine. I know you've given this a lot of thought, and I think, like Marta said, once the Office of Aging is and Director are in place, this will be a wonderful resource for the whole county. It's really important. So I'm glad you've done all this work. Thank you.
Well, I'm going to be a little more ambitious, Phyllis, than the county. I'd really like to reach out to Ageways. You know, one of the things, Ageways, I looked at your information. Of course, I looked at the Alzheimer's. Alzheimer's is, you know, name, address, and telephone numbers. Ageways has a little more information, and with the right question, I did get some information on Laura. But again, you know, if I didn't know how to navigate that, I wouldn't have been able to obtain what I wanted. But, you know, Kitty, I'm really thrilled with your background. I think that this is something that I'd welcome your input into, because I see this as something that can be helpful and take away the work that goes on in maintaining these things. I think the care seeker can use a workbook kind of format to get the relevant information that they seek. I'm going to give you an example here. You know, there are 3 types of assisted living. There's the homes for the aged, there's the adult foster care, and there's the exempt homes for the aged. Now, here in Washtenaw County, if you visited the evangelical homes of Michigan, you would not know that their assisted living is an exempt home for the aged, and that their memory care is licensed in adult foster care. But if I'm starting out there in independent living and I'm going to be moving through their continuum of care, what would it mean to me to move into an exempt home for the aged? Well, it would mean that they have no disclosure requirements. Laura does not inspect them. Those are pretty, you know, that may make me think twice about wanting to move in there. Not that I have any complaints about them, but that's their business model. And maybe that's a business model I'm not comfortable with. Maybe I want someplace where they have yearly inspections and where there are required disclosures. So I think that's the kind of thing that we want people to be smart about. Because there are such great consequences. And it's a great cost, not only financially, but personally.
Stephanie?
Yeah, I was just going to respond, Justine. Following this, we can be in touch with you. I think the guide that you're talking about putting together, I can connect you with our resource center. They're really the ones that provide that information. So we can talk offline following this.
Thank you.
Yeah.
Any other response to the public? Margie?
Yes, you know, I had a little trouble hearing some of this, but I was trying to adjust my volume, but one of the things that I think is unclear to many people in various types of living arrangements is the availability of the ombudsman.
Right.
And it seems to me like it's a well-kept secret. I know it's posted, but who stands around and reads those things? So I think that has to be very very apparent to the reader. I think it's a great idea, the booklet, and yeah, so kudos.
That would
to
be
you.
included. Troubleshooting resources would be included.
Okay, yeah. Yeah. Thank you.
Anyone else? Great. Thank you so much, Justine, for coming and sharing those comments. Katie, I have just a quick question for you. Are you related to John Scharf in Webster Township?
Not that I know of.
Oh, okay, great. All right, I'm going to remove your permissions to talk. And up next is our approval of the minutes. Do we have a motion?
So move.
Second. Phyllis, great. And vote please, Stephanie.
Yes. Juliet Ballard,
Yes.
Marta Larson,
Yes.
Marie Gress, Margie Reynolds,
Yes.
Jennifer Green,
Yes.
Phyllis Herzig,
Yes.
Bruce Astreen,
Yes.
Brenda McKinney,
Yes.
Allison Foreman,
Yes.
and Madden Litton.
Yes.
Motion passes.
Thank you. Up next are discussion items. And first off, we have Catholic Charities. And so I know we have Kasey Kerr for that. Stephanie, if you could promote Kasey. And I know we have Sue Reynolds now. Anyone else from that team? Hi, Kasey.
Good morning.
Anyone else on the attendee list that's from your team you need promoted?
Nope, just myself, and Sue is new to our organization, so I had her join in just to kind of get an understanding of everything. But it's just the two of us.
Great. Stephanie, if you can give Kasey permission to share. Kasey, I'll turn it over to you.
All right, are we all seeing my screen? Okay.
Yes, we are.
Great. Well, thank you for having me. My name is Kasey Kerr. I am the Director of Senior Services and Quality at Catholic Charities. Okay. I have been with Catholic Charities for about 7 years. And before I dive into this, I just want to mention our name change. You may have previously heard us be referred to as Catholic Social Services, but over the last year, we have changed the name to Catholic Charities. We are associated with the Diocese of Lansing, and all of the other charities under the diocese maintain that Catholic Charities name. So to keep it consistent with the other charities in other counties, we rebranded and renamed to Catholic Charities. If you're not familiar with our organization, we have been present in Washtenaw County for over 60 years. As an organization, we offer services from the very beginning of life to the very end, through children and family services, behavioral health services, and then of course, what I'm here to talk to you today about is our senior services department. On the screen, you'll see a breakdown of 3 different categories, which are our programming can fit into these 3 different buckets. And as we advance forward, I'll go into more detail, but generally we have our home services. So programming that is intended to keep seniors and older adults safe in their homes. Resource navigation services, which is really offered on a spectrum. And then caregiver services, which again, Sue, who has joined us today, is our new caregiver services coordinator and responsible for the 2 programs under this category. Our home maintenance and safety services, as I mentioned, are intended to keep seniors safe in their home. Eligibility is 60 years or older and living in with Washtenaw County. Our services include basic home maintenance and minor repair services. So things like changing light bulbs, basic plumbing, routine maintenance. It's hard to define what the scope of our service is, because sometimes we are able to do what is needed, and sometimes it might be requiring a little bit more of a skilled profession. Included in our home maintenance is outdoor chores. So we maintain a list of about 40 seniors who routinely receive lawn care through our organization. I'll mention that we are not a landscaping company. Our services are primarily just to prevent citation and overgrown lawns. And then in the winter, we also do ice and snow removal. In addition, we have home safety installations, so things like smoke and carbon monoxide detectors, grab bar installation, and anything in the bathroom that might be helpful, like shower chairs, transfer benches, and raised toilet seats. New over the last couple of years, I built off of our previous scope of programming is the Home Safe Senior Initiative, HSSI. And this was supported by Washtenaw County ARPA funds. And the idea behind this was that we really see people calling our organization often that have that need for home safety beyond what we are able to provide, but maybe don't meet the qualifications for a major home modification service. So things that are mild to moderate is what we're talking about here. So through this program, we have been able to provide financial assistance directly to seniors who need to pay a skilled professional. So a lot of plumbing, we've been able to replace some furnaces in the winter. It kind of has run the gamut. Clutter removal is something that we've dipped our toe into. Of course, that is always a little bit more complicated. But essentially, this was intended to really extend what our current programming is able to do and bridge that gap between mild home repairs to the very severe repairs that are needed. So yeah. Moving on into resource navigation. As I mentioned, this is offered on a spectrum. We start with our resource directory. You may have seen this around the county. This is something that we have produced for over 25 years. It comes out annually, usually at the beginning of the year. It looks very similar to what you see here on the screen. And every year it's updated. We have very limited space, and we have tried to play around with the formatting from time to time, but it is not comprehensive of every resource in the county, but we try to fit as much as we can on this. It is a paper directory, and organizations and individuals are able to place orders, and we will get that out to you as soon as possible. Building off of that, in 2019 and 2020, we developed the Senior Resource Connect website. Another little name change here, this previously was called Ahead of the Curve. This took our paper directory and built it into an online searchable directory, listing over 500 countywide resources, state, federal, all of that might be applicable to someone searching for senior resources. In addition to that, there is a self-assessment quiz. Maybe you're wondering, what you might benefit from. So there's a tool on there to help narrow down resources that you're interested in. We have crisis guides. So for those, unfortunately, in a situation where they might be in crisis, elder abuse, or domestic violence, there is a guide to help walk through that process, including how to contact and make a report to Adult Protective Services. In addition, we have a weekly blog that comes out covering aging topics, caregiving, highlighting other organizations in the community. Rachel, who oversees this program, does a wonderful job at coming up with new topics to cover weekly. A build off of that is our resource advocacy program. This is a person-centered light touch program. So our resource advocates are able to help with simple information and referral giving. And then they're also able to help individuals who might need a short-term intervention for an immediate need. So think of things like emergency funding to pay a utility bill, filling out Medicare or Medicaid applications, food assistance, and really helping individuals get connected to meet their immediate and basic needs. Again, we've learned through the resource advocacy program that, that really isn't enough and we need to be doing a little bit more. And so through the support of Washtenaw County and the ARPA funding, we have piloted a case management program. This is still getting traction here at our organization, but this is intended to help individuals beyond that basic need. So those who might have a more complicated case, they need ongoing support over a longer period of time. We are able to provide some case management to ensure that there are no gaps in services. There's a little more about our case management program. And then coming soon, I should mention that the primary funder of most of our programs is Ageways. And then we are contracted with the state of Michigan and Ageways through a No Wrong Door grant to offer person-centered options counseling. This will be offered in our resource navigating spectrum of services. And the difference between this and what the two previous programs I discussed is that this can be offered to individuals regardless of age and regardless of living situation. So our services are primarily offered to community dwelling older adults, those not in long-term care facilities. Once the person-centered options counseling is up and running, we'll have more ability to offer that service to those in different situations. Again, this is a program through the state of Michigan and Ageways, so there are a lot of new things that are coming down, and I don't have quite as much detail about how this will look, but just know that it is going to be coming here shortly. We're able to offer some community education on several topics. We have developed training on elder abuse. So there's training on 5 ways we can all prevent elder abuse. As I mentioned, this goes through the process of reporting to Adult Protective Services and defining what elder abuse is, and how to look out for it while you're interacting with vulnerable adults in the community. And then within the last year and a half, we have developed a staying safe online training, so focused on consumer protection and cybersecurity. These trainings are available for the community. We host them here at our organization, but also partner with local senior centers, senior living facilities, anybody who's willing to have us. We're welcome, or we're able to come out and host this. A newer program that replaced a program called Get Connected is Seniors for Healthy Choices. This is a 6-week wellness and prevention program for older adults to celebrate healthy aging and making healthy lifestyle choices. So topics include medication management, and just maintaining a healthy lifestyle throughout aging. This is an evidence-based program supported by the Community Mental Health Partnership of Southeast Michigan. Again, welcome we host this here at our organization, and I believe next week we'll be hosting this for the first time in the community at Sequoia Place. Another flyer about the Seniors for Healthy Choices program. We also have a medication toolkit that's available for any senior. It includes a medication diary, information on common medication side effects based on the Beers criteria, which again is an evidence-based tool that lists common side effects and medication interactions, and just other practical tools for managing a prescription medication regimen. Lastly, in our resource navigation bucket of services is the Retired and Senior Volunteer Program. You may have heard of this program recently, as it has been in the news. It is an AmeriCorps program, and the best way to describe this is it is a it's kind of like a staffing agency for volunteers. So if you are 55 and older and looking to get involved in volunteering in your community, you can contact us at RSVP, and we will help you find a volunteer opportunity within Washtenaw County. We have partnerships with over 40 nonprofits in the county who then relay their volunteer opportunities to us. And if you are, interested in maybe Meals on Wheels, delivering Meals on Wheels, we would funnel you to the correct person wherever your location is. A benefit of being a part of the RSVP program is you are provided volunteer insurance. So anything that your personal insurance would not cover during your volunteer placement, there is some liability insurance that we are able to provide. And then, of course, there is recognition events. We typically hold a recognition event annually, and smaller ones throughout the year. Okay, moving on to our caregiver services program. The first one under this bucket is our volunteer caregiver respite program. So very simply put, this program provides respite care utilizing volunteers. We match volunteers with caregivers and seniors who could use a respite break. There's no cost to participate. Volunteers are not required to provide any direct care or medication management during their visit. It's just a social visit, and it's also intended to offset the cost of private pay respite. In some cases, we are able to provide this service to individuals who have absolutely no support at all. And in some cases, we're able to provide it to an individual who needs 24-hour respite, but their paid provider isn't able to come between the hours of 2 to 3 hours, and we can send in a volunteer to cover that gap. As I mentioned, Sue is joining on the call today. She's recently joined us, and she has some wonderful ideas of how we can expand and increase the services that we're offering to caregivers, including some support groups and some other supportive programming. So there will be more to come with this program, I am certain, in the future. And then lastly is our Grandparents Raising Grandchildren program. This is a program that is offered to kinship caregivers who are over the age of 55. It's called Grandparents Raising Grandchildren, but it can really be provided to anyone who is over the age of 55 caring for a younger relative who is younger than 18. Typically that occurs through a traumatic experience, either the death of a parent, a mental health crisis, or substance use, incarceration. There's a number of reasons why this caregiving relationship may have occurred in the first place. And so our program, although very small and growing, is here to provide support to that kinship caregiver, whether that is providing support that they require to manage their own situation, or whether that's to help them connect back to resources that will allow them to better parent at an older age for the younger individual in their care. So we offer support groups, newsletters, educational workshops and presentations, and then resource navigation as well. So here's one of the Grandparents Raising Grandchildren newsletters. And that's it. Are there any questions for me?
Please raise your hand if you have a question. I know I have a few. Bruce.
Thank you for the presentation. I've always been very impressed with what you guys are able to do. The overriding question I have is how much of your ability to do this depends on federal or somehow federally or originating funds? For example, Ageway, we don't know what's going to happen with the future budget. The things I'm reading are kind of discouraging as much is, and ARPA monies are long gone. So I just wonder how much of your budget depends on those federal dollars.
Most of it. Unfortunately, yes. Ageways is our primary funder. We've held those contracts for a very, very long time. But as you mentioned, the uncertainty with federal dollars is very real. I will say that you may have heard our organization has gone through some leadership changes over the past year, and something that has been a priority for leadership is making a more concentrated effort on securing private funding, so that if these contracts or funds were to no longer be available, that we can continue to provide these services independently.
Good luck.
Allison?
Hey, Kasey, good to see you. Great presentation. To kind of follow up on Bruce's, like with the federal funding, I wanted to ask, do you guys work with any insurers for any of the programs, like to get any like Medicare or Medicaid pass-through funding?
We do not know. That is something that we are looking at for case management at the moment. So in resource navigating, just as I mentioned at the beginning of our presentation, we have a behavioral health department. And so in tandem with our behavioral health department, I think there is some way to get reimbursement. As you know, that's very complicated and convoluted. So we're looking at that. We've investigated the home maintenance and safety repair reimbursement process in the past, and nothing really came to fruition. But it's always something that if it's possible and there's a clear way to do it, we're happy to move forward in that direction.
Yeah, because that could be a path to look at more with the struggles of the federal government funding as well. I just wanted to point out, and it might be for later, Marie, I remember a while back, a couple of years ago, Kasey and I, we had talked about, because you used to live in Colorado and you worked for a unique place that did really cool housing. So when we get further down the millage stuff and they're talking about different housing, Kasey worked at a really cool program she might be able to share some insights on.
Absolutely.
Fantastic.
It's called Havod Senior Life. If you ever have a moment to Google it, it's wonderful.
Well, one of my questions, since we're talking about some funding things, is do you have any comments, feedback, hopes and dreams about the older persons millage and how they can support your work?
Yeah, my hopes and dreams are that it can support our work. I think that all of the organizations, all of the senior sector organizations that work to provide services to older adults are wonderful and do this with their whole hearts. and we're here and we're doing it. And I just hope that the older person's millage is able to support what we are currently doing and then expanding even further to meet the unmet needs. So I think that's in general, that's my hopes and needs for that.
Great. Any comments on the current policy document if you've had time to review it?
I have not, no.
Great.
I read the first draft, but I have not had a moment to review the most recent one.
Super. I had a couple of questions about your impact. They're all related, so I'm going to read all three and you can answer them however it makes sense for you. How many people do these programs serve? Because those are quite a few programs, right? And then with thinking about the people that you serve in your programs, do you see clients from all zip codes across Washtenaw? I know you say that they're all eligible, but I'm interested in if you're actually seeing people from all zip codes or if it's more closer to where your home base is. And then how big is your team doing all this work?
Sure. So we have a team of about I want to say that 8 or 9. We have a part-time seasonal staff right now to help with the lawn care. So that is my team. Sue, who I've mentioned a couple of times today. She is a team of 1 covering both the grandparents and the volunteer caregiver respite program. We have in our home services program, we have a manager who coordinates all of the clients, and then we have 2 FTEs for service technicians who provide all of the maintenance work, including the lawn care and snow removal. And then in resource navigation, we have a team of 4 individuals, and then myself. So that is that. In terms of volume, I am the perfect person to ask for this because, as I mentioned, not only do I organize or oversee our senior services department, but I maintain quality for our entire organization. And that is really looking at data and statistics of what we're, who we're covering and who we're serving. And so I would say in general, our department reaches about 1,000 older adults with all of the services combined annually. Some of the programs are smaller. Our kinship care or grandparents program is, I'll just be very transparent. We receive about $15,000 for that program annually. So you can imagine that reach is smaller than what we might be able to do with programs who are more funded. We have about, I think, 27 individuals that we've connected with in this fiscal year through that program. So it kind of depends and varies on where the resources are. And then we do serve individuals throughout the county. I will say that our primary utilization is in the Ypsilanti area. We have recently put concerted effort into connecting with the western part of the county. So we have a really great relationship with the Chelsea Senior Center and collaborate with them on their Ease the Day program. You know, obviously serve anybody who is needed, but I would say the concentration is Ypsilanti and then maybe the 48103 area.
Great. Do you have wait lists on any of your programs?
We do, yes. So unfortunately, with our respite program, for instance, it's volunteer dependent. So not only is it volunteer dependent, there are some dynamics. So if you have a caregiver who is seeking respite at a certain time, but you don't have a volunteer in that area available at that time, it just requires some extra legwork. And that individual will be placed on a wait list until we are able to find a perfect match. And then with our lawn care and our snow services, I don't want to say that we have a wait list because we try not to keep somebody just in limbo. But limited capacity for those 2 services just prevents us from reaching everybody who needs it. We get tons of calls for those two services yearly. And like I mentioned, we're not a landscaping company, and we have our own equipment, but I have got two full-times, two FTEs. So I've got one full-time staff member and two part-time staff who provide all of those maintenance services in addition to the lawn care. And so just meeting that need is the need that is present in our community is challenging. So.
Great, thank you. That's all my questions. Brenda, I see your hand.
Kasey, I think you answered my question. I was going to ask you if the person needs to provide their own equipment for the lawn care, but you just said that you guys provide that. So.
Great. Bruce?
Kasey, do you guys have any way of estimating the costs of these programs, especially as you're now considering having to go to funders, new funding sources? I mean, obviously, the value of volunteers is hard to calculate, but I'm just wondering, I think so much of what you do is so important and we need to do more of it. And for government or philanthropy to start to consider how to support this work, sort of having reasonable estimates of what these things cost, and sort of along the lines of some of Marie's questions about, the number served and all those kind of things. So do you have that kind of information, or are you able to sort of put your best estimates together?
I could put a best estimate together. I don't know that I have that number for you right off the top of my head, but I could certainly come up with something. The thing I will mention is that when you're talking about the cost of these programs or the return on investment, the program that is going to stick out in my mind is our home services program. So, Brenda just asked a question about equipment. So there is an investment on our end to maintain all of this equipment that we have to mow lawns, but then you're also looking at the cost savings of citations from seniors who are not being cited by the city for overgrown lawns. So it's comprehensive and a good, accurate way to capture all of that. I don't have, but I could probably come up with something very general.
Thank you.
Brenda?
Kasey, this is something that our commission has talked about, duplication of services. And I don't know if anyone on the commission knows, but I think there is some other programs around that provide lawn services. And I'm just wondering if this is a way that maybe you can find out what other programs and organizations are helping seniors, and maybe you can come together and work together, because I know there are other organizations who do lawn services. Is there anyone on the commission at the top of your head? Can you think of other organizations that provide lawn services?
Off the top of my head, the only other group that I can think of that does lawn services for older adults is the city of Ann Arbor has a program for youth to not do their PE class. There's a word for that and I can't think of it right now, but instead of PE class, they can do lawn and snow removal. But I don't know of any other groups who do an organized program the way that Catholic Charities does. Does anyone else? Or, Kasey, do you know of anyone else?
This winter we were contacted by the compliance officer who works in the city of Ann Arbor, who I believe she is responsible for lawn and snow and ice clearing. In the winter, she was trying to organize some support for those for snow removal. And so we were referring back and forth for those programs, but I'm not aware of anything that does it, that provides a service similar to how we do.
Okay, thank you. I was just wondering, because if there were, we could maybe, organizations can join together and work together. And that's, Thank you.
Absolutely. I will say that this year we have tried to incorporate volunteers to provide this service. Again, that's wonderful. We've been able to actually park a lawnmower at an individual's home, and then we have a volunteer who's able to come over and mow her so that our staff does not have to do that.
Okay.
But doing that on a larger scale would be a challenge. We're still investigating how we can use volunteers in a better way to support these programs as well.
Okay, thank you.
Anyone else? Questions for
Thank-
Kasey? All right. Thank you so much, Kasey, for coming and doing this presentation. I'm always impressed by the work that you guys do.
Thank you for having us.
Mhm. All right, then, next discussion item are our subcommittee updates. So we'll do, communications and future planning, then town hall, and then we'll get to the millage stuff. On communications, that's myself and Madden, Madden, and, I didn't have any communications. Madden, did you hear anything? Super. Future planning, did you all have a meeting?
No.
Nope. Great. Town hall, any updates?
Yeah, Madden and Bruce, if you want to chime in, just go right ahead. Right now, we're waiting to see how the budget cuts are going to affect our existing programs. And we're searching for speakers to talk about the cuts who are knowledgeable in the areas and how it's going to affect seniors. So that's what we're waiting on, to see how the budget cuts are going to affect our existing programs. And we're also waiting to see where the millage dollars are going to go in Washtenaw County. So there's a lot to kind of wait on, and there's a lot happening. So
Yeah.
Bruce or Madden, did you want to chime in?
The only thing I'll say is, there's, ironically, there's been a number of other town halls that have been taking place. Many of them coordinated by or involving Board of Commissioner folks. And I think we were kind of waiting to see how that all played out as well. And obviously it has to do with things around the implementation of the millage. And so I think Brenda hit it on the nose. We've kind of been waiting to see how the dust settles a little bit. And similarly for the future, I did happen to have some interesting conversations with Board of Commissioner people over the last week or so. And there's the one thing I will say, and this will come up more in the millage conversation, is that I think there's a lot more comfort and interest in working with the Commission on Aging. There just seems to be a recognition that we have a real meaningful role to play. And I think that's been an important development.
Great. All right, let's transition to the millage work group. Bruce, I know you've been to several town halls recently. Do you want to give your update first?
There were two town halls in particular in Ann Arbor. One that was held just by Commissioner Robbie, that was last Sunday. And I wrote up some notes for some of the folks. I don't know if that got to everybody or not, but if not, if you're interested, we could do it. But it basically reaffirmed a lot of his personal views on the millage. And he got an opportunity to listen to a number of comments and questions from the audience. The Sunday meeting was a smaller one, probably about 15 to 20. There was another meeting yesterday, again in Ann Arbor, that included Commissioners Labar and Commissioners Katie
Scott.
Scott. I was going to say Shaw, Katie, Scott, and Annie was there in the audience as well. She spoke a little bit, but mostly it was the three of them along, the two of them along with with Robbie. And there were a number of a little bit larger group, maybe 30 folks. And it was both, I think the nature of both of them was sort of catching people up on where things were in the discussions and deliberations and debates within the commission and the Board of Commissioners, and then listening to questions from the audience, sometimes on point and sometimes just things that people had on their mind, things that they were concerned about. For example, there was one person who was interested in the possible changes at the state level in driver's license approvals for older adults. So people would have, sort of typical, personal questions, but I think a lot of people were also kind of just really wrapping their minds around what the millage is about and what it could possibly do. And so the questions were sort of aimed at better explaining things, where they stand right now, and what kinds of timelines, what kinds of expectations around the bureaucracy. And there's always a lot of questions around costs and how much this is part of the bureaucracy and where is it located. And again, people have been answering those questions as well as they can at the moment. So I think that's a kind of a quick overview. If people had more specific questions, there wasn't anything out of the ordinary. The one really nice takeaway was the one I just mentioned about how they mentioned our involvement a lot, and they talked about how they see a continuing important role for the Commission on Aging going forward.
Thank you, Bruce. That's a good overview.
Anyone else from the subcommittee have anything that you wanted to add to that? Otherwise, I can share about the the Board of Commissioners meeting. I was just pulling up my notes. So at this last Board of Commissioner meeting this past Wednesday, they had at regular session the first reading of the policy. There were some additional documents like the the drafted job description for the director. They had information on the senior center discussion, because that's probably been the most complicated piece that they've been talking about, since it's a guaranteed like flat amount going out. There's been a lot of discussion there. It went long. They did start late because they had a robust discussion at working session, but it went until almost right before 2 a.m. before they wrapped up the conversation on the senior millage and the senior center allocation. So they did 2 resolutions. Both of them passed first reading. So that's like the short story takeaway, is that they both passed first reading. There was 1 no vote on the policy, and he stated that his no vote was because he wanted more information from administration and OCED on what moving particularly the SNP, Senior Nutrition Program, to the Office on Aging would look like, what that cost would be, what implications would be. OCED is considered a community action agency, and once if there's too much community action removed from that office, there could be other implications. And so he wanted more of that information at second reading in order to vote yes. And so we anticipate that being one of the bigger items that they discussed during the July 2nd reading. Some other things that they talked about, they added in the core priorities, the initial ones, they had door through door, but they added door to door. For those of you not familiar with the difference between those, Curb to curb is your typical taxi, where you just pull up and you get in the car and the driver never gets out. A lot of senior serving transportation programs will offer door to door, so they'll walk up to the door and help make sure that the person can get out of the home safely, down the steps safely, into the vehicle safely, and same thing for once they get to their destination. And then door through door is when that driver or staff member volunteer goes into the home to help the person get outside, from inside to outside of the home into the vehicle. And same thing when they get to the destination, into the doctor's office. And different programs that offer that extra layer of service will do it until they hand off to the receptionist. Some will go hand off in the doctor's office and things like that. So those, they added the door to door. It is, yeah, the door to door. I'm looking at my notes. Back to the, they had discussion on county recognition, how robust or flexible that should be. And they ended up keeping the same language that's in there now, basically that if agencies are receiving senior millage dollars, there should be recognition. I think minimally it has the director of the office installing signage or handing some sort of signage off to the agencies, and that's where that's landed for now. Again, lots of discussion on the senior center piece. How do you define, how are we going to define senior center in Washtenaw County? There used to be a more national recognition program that no longer exists, and so they were starting a little bit more from scratch than what they anticipated. They landed on 10 official senior centers in Washtenaw County. They recognize that the Milan Senior Center is would be one of those senior centers that they would recognize, but their address is actually in Monroe County. And so they discussed how getting senior center funds to that senior center will have to look different. The amount might be a little bit different. And Commissioner Beeman commented that she has been in contact with the city of Milan and the senior center. And I've been involved in those discussions as well, because it's in my district and I live in the city of Milan. And then the other piece that ended up having a little bit more discussion, I mentioned that there was a commissioner who voted no because of moving some programs like SNP, Senior Nutrition Program, and foster grandparents, currently in OCED, to the Office on Aging. A couple commissioners hadn't realized that that move was proposed in these documents, but throughout the discussion, it was discovered that even in, and you'll probably remember this too, when Andrew DeLue from County Administration came to talk about what in their minds the office could look like, they had already proposed moving those services to the Office on Aging. And so now it's just getting a little bit more to the upper, I'm not gonna be able to say that word today, how that actually is implemented. I think those were the highlights. Are there any questions on that right now? Brenda?
Yes, Marie. For example, the recognition part, can you explain that explain that again, please?
Sure. So currently in the policy, it says that agencies who receive millage funds are going to be required to recognize, somehow like promote or, you know, for the most part, what that currently looks like, as an example, the senior nutrition program is what funds Meals on Wheels and congregate meals. And so they put the county logo on
Okay, got it.
materials on the website.
Got
And
it.
that's how it
Okay.
stands now. On one of the commissioners was pushing that it should be even more recognized. And in his proposed amendment, it was at the point of service delivery, which I'm glad some commissioners pushed back on that. If you think about service delivery in terms of transportation, every ride that we provide, we would have to say that. And if we're taking someone one place and we're bringing them, that's 2 times in a day that we're telling them. If they're doing dialysis or if they have to go somewhere every day, we'd be saying that every time, which is taxing on the individual, annoying, and other things. It would be difficult for the driver. And the other concern that would raise is if in my case, a driver, in Meals on Wheels case, a volunteer delivery person, if they are forgetting to say that, does that hurt our contract, our opportunity to continue working with the county? So I'm glad that some commissioners pushed back on that a little bit. So does that help?
Yes, it does. And the other question for you, was there an amount mentioned for the senior centers?
Yes, they're sticking with the 200,000 as a base funding. There was talk about should there be a formula for equity to determine which centers could get more or less and that kind of thing. And Jason and Annie, their primary comments were that this is floor funding. His initial idea when they came up with the number was that it's funding some primary staff. Senior centers have a harder time getting grant funding. They have a harder time. Everyone has a harder time with like administrative staff getting grant funding for. So initially, when they came up with that number, is let's make sure every senior center in our county is going to be able to have an executive director, a program director, and a staff administration, and be able to pay those people well, cover that number, cover taxes, fringes, that kind of thing. And then all of them are encouraged and welcome to apply for additional funding based on their membership, the programs that they offer, the needs in their community. And so that additional equity piece comes in kind of in that RFP format is the justification during their discussion.
Okay, thank you.
Yeah, of course. I see Marta and then Bruce.
Yeah, I had 2 questions about the allocation for senior centers. Do they produce a list of what they consider to be a senior center? Do they have a list of recognized senior centers?
Yep, they have a list of what they landed on, and on that list, I'll have to pull up the document in a moment, but on that list, they added Lincoln Golden Ages. That was another item of discussion. There was 3 potential, like, is it a senior center? Is it not? It was the Jewish Community Center has the WISE program that could possibly be considered a senior center, the Turner Resource Center, and then Lincoln Golden Ages. And after their lengthy discussion on those, they decided that Lincoln Golden Ages would be considered on their list of senior centers for this initial distribution, and there would be continued discussion on the other ones. And in the immediate, those other 2 would be definitely eligible to go for programmatic RFP dollars. I'll find the list that they produced for their packet, and we can send that out if that's helpful.
Yeah, my concern is that on one of the preliminary lists I saw, my local senior center was not on the list, and I want to be sure that they're on the list.
Sure,
That
sure.
would be Northfield Township Senior Center.
Yep, I will take a look at that one. Is that one in the county boundaries? I know there was a Whitmore Lake related senior center.
Yes, it's in Whitmore Lake in the Washtenaw County side.
Yeah, I'll look at the list, but I was pretty sure that one ended up because I was nervous that one was going to be in the same situation that the Milan Senior Center was.
No, it's not.
But they are in Washtenaw County, so I'm pretty sure they're on that list, but I will find that and share that with you.
We need to check that because they are funded by the Northfield Township Board.
Yep.
which is in Washtenaw County. And the other thing is, we had suggested when in preliminary discussions that all of these senior centers that are operated by government agencies obviously have some sort of budget, you know, be it large or be it small, from that government agency. And we had suggested that the government agency be required to not use village funds to replace tax funds that they're already allocating. I'm getting some feedback. I don't know if someone's got a mic on that is speaking. Anyway, the concern was that municipalities would then take the millage money and then cancel their general fund money that they're using to support the senior center, and we don't want that to happen. So is there any sort of requirement discussed to have them have a memorandum of understanding or some sort of legal agreement that they would not do that?
I know that has been a concern with other senior centers. That was not something that they discussed. They discussed their own do not supplant current funding from the county, state, and feds with senior millage dollars. So in their policy document, we discovered there was that 95,000 of general funds that were being used towards senior programs, and with their not supplant clause that keeps that money there. But they did not, to your point, talk about the localities changing their funding structure. And I would encourage you to, when Annie's joined us, to bring that up again.
We'll do that. Thank you.
Yeah. Bruce?
Just a little bit more on a couple of the issues that we just talked about. I think both the equity and the eligibility, let me start with the eligibility of which senior centers, that and the question of equity, I think are still not finalized in terms of definitions or how we should think about them. And I think I know in some conversations with several of the folks, including Annie, they would welcome some additional thoughts from us. I spoke a little bit with Annie yesterday about just that there's some newer, you know, there may be a need for a kind of an updated definition that could help, along with criteria that could help determine not only current but any future senior centers. Because there was a lot of discussion about really not only some of which centers may or may not legitimately be senior centers, or what if somebody just opens their door and says they're a senior center? I mean, there's no longer a state or federal body that that sort of defines senior centers. And I think if Annie seemed to suggest if we could come up with our own criteria or thoughts a little bit, that would be helpful. I think that a similar thing around the equity question, because I think there's the issue, I wrote this up in my notes from the earlier Ann Arbor meetings where the equity thing came up. There's the questions about the rural urban equity, and then there's questions around poverty and income. There's a number of different formulas that I think we could draw from that could be helpful to the commission to have them think about equity going forward. As Marie mentioned, they're talking about it kind of this baseline to just get some of the money out the door. But I do think in terms of going forward, when you have those tensions between the rural and between the urban and between those who are in greater need and what constitutes need, that might be an area that we could really help weigh in on. And fortunately, there is some useful formula information to draw from. I think the last thing I'll say is that another issue that came up in some of the discussions, at least in Ann Arbor, was around this decision to make the early funding commitments, not only to the senior center, but to the food gatherers. And that really raised a kind of question about what kind of short-term response we need to have versus what kind of a longer-term, more thoughtful planning response. And again, that kind of harkened back to our earlier recommendation for this advisory planning group to hopefully get that into play as soon as possible, because I think people are recognizing that with all the stuff going on in DC and everything and the impacts, we need to both be able to respond rapidly, and we also need to have a more thoughtful, longer term plan as quickly as possible. So, and everybody seemed, at least not everybody in the meetings I went to, seemed open to that.
Yeah, thank you. Marta? You're muted, Marta.
Sorry about that. Bruce, you raise a really good point about the rural versus urban issues, because one of the biggest differences in the county is the availability of senior centers in the rural areas of the county. And so that also caused me to think that maybe we need to suggest that they address questions about that might arise, because municipalities will see that the county is giving money for senior centers and decide to start a senior center in their jurisdiction, and how to go about addressing those issues. I know of at least one township that's seriously considering that issue right now, that does not currently have a senior center located within their boundaries. And so how to address those issues, I will bring that up also when Annie's on, but it sort of, when Bruce was talking about rural and urban, I think that might be something for the millage task force to take up and discuss.
Yeah.
I agree. I agree.
They did talk about the concern that local groups would do exactly what you're saying. Now that there's a senior millage, that they would establish this, knowing that they could get like that base number funding, which is part of why they decided, and I think this was even the subcommittee's suggestion, that you just make a list instead of having a definition, that you make a list and have those identified. And in order to get funding in the future, they would have to get approved to be on that list, right? I do have the list now, and I'll read it off. It's in alphabetical order. It's the Ann Arbor Senior Center, the Chelsea Senior Center,
Wait a second. Okay.
the Dexter Senior Center, Manchester Senior Center, Northfield Township Community Center, Pittsfield.
Community.
Yeah.
This list can be also sent out. We don't need to write it down necessarily.
Okay, you got Pittsfield and who else?
Pittsfield, then Saline. There's the Ypsilanti Senior Center and the Ypsi Township Senior Center. And then to that list, they added Lincoln Golden Ages.
I think, Marie, I was speaking more not about local small groups, but about municipalities. So
It would fall under the same. It would fall under the same. They wanted to have a list so everyone's on the same page about who qualifies. So even if a township, a municipality decided to spin up their own senior center, it would still take time and approval to get on this list in the future.
So
I know something that they talked about for the RFP that I would assume applies to this, but this is my assumption, is that the agencies who apply for funding have to have been in existence and have at least an audit for the last 5 years. They have to be established. They can't just create and exist, because they reiterated that when they agreed to put the millage on the ballot, they were also thinking about maintaining and expanding existing services. And so for new services to come in, new organizations like a new senior center to come in, starts to hinder some of what they hoped this millage would be able to accomplish.
Yeah, but so I think that's something for the millage task force to take up and discuss, because 5 years in existence is a pretty long time, particularly for a new municipal senior center. And so we need to figure out what's a reasonable way to approach this, so that we don't squash initiatives of local governments that might decide, okay, we've been sort of not doing this, but we need to get busy. And, I would think that they need to dedicate some funds. They shouldn't be able to just start up a senior center and collect millage money to run it. They need to have some skin in the game on their own part.
Exactly.
I would
Exactly.
also, and I think that's a great idea, and I would also
Exactly.
encourage you
Mhm.
to look at county procurement guidelines because it would still have to fall in place with all of that.
Mhm.
Yeah, so I think maybe we'll have a meeting of the millage subcommittee to talk about this.
Super.
Mhm.
I see Phyllis, then Bruce, then Brenda.
Mhm.
Um, so it's my understanding, I've heard this from Annie a couple of times, that and this could apply to a group wanting to start a senior center, is that they can apply for programmatic
Mhm.
funds. I mean, the Jewish Senior Program has been in existence for 25 years. So that's not a new thing. They've rearranged some of the structure, but so going after program funds is a good way of solving some of these questions that you've brought up. I just wanted to mention that.
Yeah.
Thanks, Marie, for letting me know how long that meeting went on. I watched some of it yesterday, and oh my goodness, they're nitpicking over punctuation almost. So
Yeah. Some of that could have definitely been an email prior. Yeah. Bruce, then Brenda.
One thing that might be really helpful that we could think about is, I actually think the equity and eligibility questions are tied together. And the thought that I had was that, number one, if we could help with a formula for the equity and then a process for determining future eligibility, at least. And by that, I mean, we've got 370,000 people in Washtenaw County. And I think, while there's equity issues in the rural area that really have to do more with, the lack of services and the distances between and the challenges that they face, and there are low income families on that side as well. But, you've got an overwhelmingly larger population in the eastern part of the county that have issues around poverty and issues around other kinds of equity. And it seems to me that if we could help them think about, number one, a formula for how we approach the aging population in numbers and have a variety of criteria, that would be helpful. And then secondly, then a distribution based on, the equity question, a distribution to those different communities, along with a process for how they determine, whatever allocation of resources they might receive, how they determine the best way to use those monies in their community. With one caveat, which is that I think some people are very much trusting of their local government to make good decisions. Some are not. So I think we'd have to have a process in which, they could come up with recommendations, and maybe the commission has some way of knowing, weighing in and saying that makes sense or doesn't make sense. It's a little complicated now, but I think that sometimes the equity question is much more, needs much more thought than just it's being given right now. And I would like to, maybe the future committee work could help on that. But I do think we're running into some typical challenges or typical conundrums where money is going to go out, and you've got a much smaller percentage of the population in the Western versus a much larger population, but the needs are very real in both places.
And I would add the costs to providing those services are very different in both places.
Yeah,
Yeah.
and that's definitely an example of what we need, I think, to figure in to how we distribute the money. So
Brenda, then Annie.
Yes, to Bruce and Marta, I really appreciate your thoughts regarding the senior centers. You came up with some great ideas. When you meet with your planning committee, would you guys keep some things in mind to consider? Like, I think like people are going to come up with ideas to create their own senior centers. I can see this happening, but we also need to consider that when you talk about the centers, they shouldn't be so close together. We don't want senior centers in every block, every 2 blocks, because that can happen with churches and different places where seniors are meeting. So we don't want to see that. And also, like how the distance the center should be. So those are some of the things I hope you guys think about um, when you come up with ideas for centers, because that can take up our whole millage if we have senior centers all over town. So, but thank you for your thoughts and, um, your consideration as far as where they should be and how they should be formed. Thank you.
Yeah, thank you. Annie, I don't think you were on yet when Marta mentioned this, but she heard that there was a municipality thinking about starting up their own senior center with all of the millage discussion, which is what got us on some of this talk ourselves. But your hand is raised, so I give you the floor.
Oh, thanks. Well, sorry I'm late. I had to be in 2 places at once today. Well, I guess I'm curious which municipality, part of the reason why we want to grandfather in the centers that already exist is to avoid that, because as Brenda just said, that could take up the whole millage. And similar to how we kind of separated Turner Resource Center and the WISE program at JCC, we want to make sure that there's like flexibility and room for centers that are affiliated with other organizations like either the university or centers that have more of a cultural lens, because we know that there are other organizations, like for example, we could see some sort of like cultural center pop up in West Willow, and that would be appropriate. But I think like obviously my opinion's been pretty firm that I think that in those scenarios, that's when you apply for programmatic dollars. And then maybe in the future, maybe as we continue to do the needs assessment and look at how we're moving the needle, maybe we redo the formula, because we do have a standardized policy at the county that we use equity as a lens for all of our funding processes. And so I heard bits of what Bruce was saying as well, and that is baked into every decision that we make, and will be a significant part of the millage review committee as well. But I think the senior center piece is complicated. Part of what I've been trying to say is the commissioners need to make it less complicated by grandfathering in the central, like regional, more municipal focused hubs, and then allow the ones that have other partnerships or have a cultural lens to apply for programmatic dollars, just to avoid some of this scenario that could, the potential of random centers popping up, because we're already looking at $2 million off the top, right? And so yeah, so that's my feedback on what I just heard since I've been on the call.
If I could add to that.
Yep.
I'm not comfortable disclosing the municipality that I heard about, because I'm not authorized to speak on their behalf. And so I'm not going to out them on, any potential informal discussions they're having. But I do know that there are jurisdictions in Washtenaw County that do not have their own senior center within their boundaries. And those are the ones that I was thinking that this might push some township boards in particular to say, oh, wait, if we put some of our funds in and start a senior center, maybe we could get some help from the county, from the millage funds. And how to balance that with, as you said, random senior centers popping up all over the place.
Everywhere, yeah.
So we have to figure out how to offer that as some sort of incentive. So I think we'll take up some of this as in the millage subcommittee to talk about, some of these issues and try to come up with some sort of thoughts about this and, certainly bring it back for further discussion. The other thing I'm concerned about, Annie, is this money that's being distributed to existing senior centers. Is there going to be any sort of do not supplant agreement with the local municipality to make sure that they don't take millage funds and use those to replace local funds that they're already allocating for their existing senior center? So I don't know if that's in the proposal. I haven't had time to watch the meeting, but
so that will happen. That should be part of the contract process.
Okay.
Because
Cool.
that's already baked into the like millage framework, and so that should be part of the contract process, and I will make it clear. I'll have a conversation with staff to make sure that that's clear enough for them, and if it's not, we can make sure that that's clear. But that's kind of the whole, like, broadly speaking, the whole point of all of this. Like, not only is the county not going to supplant any funding, but any of the agencies that we're giving funding to should not just like pull away funds that they're already putting, whether it's a municipality or a nonprofit, because the whole point of the senior millage was to expand, not replace.
Exactly.
Thank you, Amy. I appreciate your.
Yeah, and thanks. I think I saw Bruce last night at the town hall in Ann Arbor, and I mentioned to him, I would feel more comfortable if the subcommittee of this body, maybe between now and the next like week or so, could come back to me with some sort of recommendation. As some of you have probably watched the meeting, despite efforts to make this more structured and do the work of like talking to individual commissioners about their district, and also acknowledging that there's a significant part of the county municipalities that don't have their own center, but then there's like regional hubs. And so I think part of the job of the director of the Office on Aging will be to build connections with local municipalities and avoid situations where we duplicate services. Because if it's just that our local doesn't have one and we want one, versus like how close is the closest senior center that already exists, and how can we build out a different partnership so we're not wasting money on like the capital it costs to build a space, or there's just ways, I think, to do it and make sure that everybody has a place to go. And then the other thing that I'll add too, I've been having conversations with our climate resiliency officer just about like working on our climate action plans with like tackling some of these issues of people who are aging in place around just like emergency preparedness and natural disasters, and how we make sure that older adults, when we have a weather related emergency, are tapped into resource hubs in their own neighborhoods. And so sometimes, like, I think like senior center, like regional lens, but I also think there's a need to have like smaller hubs that can be closer to people in their neighborhoods, especially in cases of emergency. And so I just wanted to throw that out there, because I've only had a few conversations privately with people about that, but I think that when electricity goes out, like, I'm thinking about people who need to keep electricity on because they have machines that need to be running. There are people, I met a woman last summer in my district who had to get a generator because she's on oxygen, and her electricity goes out frequently in the summer because of, there's like different areas of Ypsi where just if the wind blows too much, the electricity goes out. And so just thinking about things like that.
Bruce?
Just picking up on some of the things that Annie was saying, it seems to me it would be really exciting if we could get communities, not just the county, but if we could get individual communities more focused, not on the issue of whether there's supplanting or not going on with regard to aging issues, but to move towards a whole different concept of supplementing, getting communities much more ready to deal with the broader questions, including things like climate, including things like housing, including all those kind of things. It seems to me that, and I mentioned this a little bit to Annie just as we were leaving yesterday, that, we have a lot of focus on what the county is able to do, and I think we're all connected to that. But I think increasingly we need to figure out ways to get other leadership that we're too city council members from Ann Arbor who attended yesterday's meeting, and I think that was helpful to them. I think it would be increasingly good if, and maybe we could even convene some kind, or encourage the Board of Commissioners to convene at some point in time, officials from city and town and, the localities that we deal with in Washtenaw County to come together to think about beyond senior centers, what they could be doing and need to be doing to make their communities more ready and able to deal with aging populations. So I think there's a way to get away from just thinking, is this money supplanting or not, and moving into a much more forward-looking way of thinking about how we plan our communities. And especially as people talk about not only aging in place, but it's really about aging in community.
Mhm.
Great. Anyone else? Comments? Oh, Marta, I have a pop-up and it blocked you. All right, Marta?
Thank you. Annie, we will get the work group together as quickly as we can. I don't know if we can do it within the next week, but I'll take a shot at it.
Oh, it's okay. I was actually thinking we don't have another board meeting for a while, actually. So there's more time.
Yeah, I think it's reasonable within the next week or two, we should be able to hold a meeting, but I'll put out an email. So those of you who are on that work group, watch out. There'll be an email coming out with some potential dates and times.
So the second reading is July 2. Typically, the packet is released usually that Friday, so June 27th, which is 3 Fridays from now. So yeah, if you guys can meet within the next 2 weeks and get that feedback, there would be a little time for discussion and getting it into the next iteration. That would be really good. Any other comments, questions?
I want to just say thank you to Annie for all the hard work she's doing for us. And Annie, I want to just say this. Sometimes we don't thank people for the good things. We can always find the bad things that people do. But I want to thank you for being a young person looking out for your older adults. And it sure gives me a peace of mind that we do have young people who do care about us. And thank you.
Well, thank you, Brenda. I'm happy to do it.
Jennifer Green?
I know that was by mistake.
Oh, okay.
I do think Annie's aged a lot from this process, though.
No, I think she has too. That was my thought, Bruce.
Yeah, you can't see me right now, but I still look very tired.
All right. So that was the millage work group and discussion. So next up is report from the Board of Commissioners. Anything else that you would like to share from the board?
Yeah, so obviously since the last time we met, a lot's happened. We had the last working session where I gave a presentation and kind of like showed my colleagues what feedback we got and what recommendations I was making to the framework based on that. So hopefully you all saw where the Commission on Aging fell into that. And yeah, we've had a lot of really fun meetings. I'm sure some of you have watched, and I'm happy with, I think, where things are going. And I think, I would like to get dollars out the door to providers immediately. But for anybody who's paid attention to the last few board meetings, a lot of challenging conversations, but I think we still have the numbers and votes to move some of this stuff quickly. Just really long meetings. So it's kind of the trade-off. Happy to answer any questions though.
Yeah, you had talked about doing transportation distribution the way that you did for food and now senior centers. Is there a timeline for that?
Yeah, so I was hoping we could have it at this last meeting, but I don't control the agenda. I know that Commissioner LaBarre at the end of the last meeting said that he wants to work on a series of resolutions to get dollars out fast. I will be honest, I kind of felt very burnt out after the last working session and trying to wrangle everyone. And so I've shared with members of the board and board leadership that there are numbers already prepared for WAVE and for the JFS transportation services. And it's not that much, so it wouldn't make a huge dent in the millage. That information's all out there. If I could put it on the agenda, I would.
I
And
know.
so
Thank
maybe
you.
I can, I could make a motion from the floor at our next meeting. But I kind of chose to pick my battles wisely this last week. So
Mhm.
Mhm.
Yeah. I will say that Jason reached out to me yesterday. Yeah, yesterday's Thursday. Reached out to me yesterday saying that he and Andy Labar were working on transportation and wanted to set up a meeting quickly. So hopefully
perfect.
that's
Yeah, I'll send them everything I have already
great.
on WAVE because
Great.
yeah, it's already sitting there. And I already have the numbers for JFS as well. So I can send that to them.
Great. Thank you. Anyone else questions for Annie?
No.
Awesome. Up next is report from the chair, and I don't have anything new that I haven't shared already. Margie.
Well, I guess it's for the chair and everyone else. I just have been reflecting on the difficulty we had in the very beginning of getting anyone to acknowledge the skills and input from this commission. And I know that many of you have made such a difference in how the Board of Commissioners values this committee. And I think it's just wonderful to see that. And so congratulations to all, including Annie and the other commissioners who have really pushed this.
Mm. Here, here.
Here.
All right. Any new business anyone wants to raise up? Great. Our next meeting, we do not meet in July because it is the 4th of July on that day. So our next meeting is August 1st. Madden coordinated Pace to come do the presentation that day. So we'll be hearing from them. And as we have other senior millage, older persons millage updates, I'll be sending them to Stephanie and now Katie to share with the group so you can stay in the loop as things develop. Do I have a motion to adjourn?
So move.
Then Marta's seconding. All right, everyone, thumbs up or yes for leaving. Great. Everyone have a wonderful weekend.
Thank you.
And Stephanie, you can stop the recording.